This is One on One. We are pleased to welcome Mitch Rothschild, who is chairman and founder of a company called Vitals. Vitals is?
Vitals is a web service and a phone-based service that helps you make intelligent choices about finding health care, knowing who's good, what other patients think, what it costs, and allowing you to make an informed decision in an area where most of us have not made informed decisions in the past.
How does it work? Break it down for us.
So when you need health care, you're going to try to look for a particular doctor, a particular facility. You want to know what other patients think of them. We've got more patient ratings than anybody else. You want to know if they're any good, if they've done that procedure. You also going to want to know what it costs. And so we partner with a lot of health plans so that we can tell you your out-of-pocket cost before you go, as opposed to just waiting a couple weeks, getting the bill and having no idea if that bill's $20 or $400. And so we'll help you with quality, cost, in some cases help you make an appointment. And if we are working with your health insurer or your employer, we will occasionally give you financial incentives to help you make intelligent choices about where to get your care.
But you had an experience personally that was eye-opening. Describe it.
Indeed. I'm a weekend warrior, do sports here.
There should be a club called Weekend Warriors, but
yes. Go ahead. Yeah, it's hopefully a little more frequent than that as I age. And I tore my Achilles and needed to get it operated on, obviously, for repair. And to make small talk on my way to the operating room, the orthopedist said to me, I'm glad you're here. I don't get to do that many Achilles in the course of a year.
Oh, that'll build confidence.
Right. And I felt that was something I should have known. Immediately, the anesthesiology cone came down over my face. I fell asleep. When I woke up, I fortunately remembered that was the kind of information I felt I should know beforehand. So we started collecting data on procedure volumes, quality of physicians, quality of hospitals, and built that up. We now have website vitals.com that gets about 10 million people a month that come and visit the site, leave ratings, get information, find out. We also work closely with a number of health plans to be their website, the front door for, say, Blue Cross of Illinois or First Care or Premera and others, and help tell people the cost before they get care.
So how do you actually, so I want to be clear on this because my information is that you don't charge consumers.
Correct.
Well, then how do you make money?
So our primary audience is the patient, the consumer, and we, in general on the web, we don't charge money. We will get paid either by what are called the payers, the health plans or the employers, for generating the cost, for delivering the information.
Got it.
And on our website for consumers, we have advertising, pharmaceutical advertising.
Okay, got it. But there's another initiative. Is it called Smart Shopper?
Smart Shopper.
What is that?
So Smart Shopper is really an innovation that we started about 1.5 years ago with a company that we merged with. And that is when you're past your deductible as a patient, you don't really care what something costs. So there are wide disparities in cost of, say, an MRI at an imaging center is $500, at a hospital might be $2,500. Almost the same quality, in some cases better. And so we will encourage you by sending you a check and helping you share in the savings by going to the less expensive ones. And we do that with MRIs and CAT scans and colonoscopies and infusion drugs and lab work and all the places where the choice of facility would help you, would save money for the system, and we want to save money for the system. We describe ourselves sometimes as being an anti-GNP company. We actually lower the gross national product of the United States because we're taking costs out of the system.
That would be a good idea, though, in that case.
In this case, obviously, as a society that is aging and getting sick, though any way you can take some cost out of the systems to avoid rationing or price increases is a good thing. And so there has been a huge growth lately of freestanding facilities that deliver care. If you were 10, 12 years ago, you might get most of your care either at a doctor's office or a hospital. Today, you have telemedicine, you have imaging centers, you have urgent care centers, you have infusion centers, you have ambulatory surgery centers, you have clinics.
Confusing for consumers?
I wouldn't say it's confusing. They don't really know. And little by little, people begin to get knowledge of it. So one place to take an example is a flu shot. 15 years ago, you're getting a flu shot at your doctor. Today, most flu shots happen at CVS and Walgreens.
I was just going to say, CVS, I was in the other day.
Right.
You want your flu shot? Is that something we need to know? Does it matter where we get it?
It's much less expensive for the system because to get a flu shot, you don't need somebody who went to medical school and had residency to deliver that to you. And so we're able to deliver that care as a society for much less cost. Similar things happen with any machinery you use for CAT scans and MRIs, drugs that you get infused in you, labs. There's a company called Theranos now that with one drop of blood can do all your lab work. Telemedicine is a much less expensive way to get care. An urgent care center instead of an emergency room. So there's all these places.
1 second, but does Vitals give information? Because obviously in public television, we're not here to advocate any product, any service, anything. But I just wanted to be clear. Does Vitals give information and evaluate these services and this technology in a way that the consumer can make his or her own choice?
Absolutely. We are provider agnostic. The industry we're in is
provider agnostic. I like that.
Yes. So the industry we're in is transparency.
No horse in a race.
Right. We want you to get the best quality care at the best possible price that you can get into in a reasonable period of time. And so we'll display the options for you the same way you'll get a search result on Google. And you can choose. You might want to go quicker and pay a little more. You might want the best guy and travel a little further. You might want to save some money or get a check, and you as a consumer decide.
Before I let you out here, you've had a lot of businesses. You're a very successful entrepreneur. Clearly, you've had many other businesses before this as well. So, you don't expect this question. Number one leadership challenge, the number one leadership challenge you have faced. I usually ask the number one leadership lesson. The number one leadership challenge you have faced in your career as an entrepreneur is?
Fascinatingly, I would say when you get a business to the size of 15 million in revenue, you just have to change the way you do things to be able to scale and grow. And we've been blessed that we've been growing 50, 60% a year in Vitals. And the example that somebody once told me is if you're a cabinet maker and you make 4 cabinets a week.
A few seconds, go ahead.
If you make 6 cabinets, you can do it. If you get an order for 1,000 cabinets, you're in another business. The leadership challenge is to be able to reinvent your business to be able to grow and scale and not to do the same things the same way.
Great stuff, Mitch. All the best at Vitals. We appreciate it. Come back and give us an update. Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by MagnaCare, New Jersey Resources, Bloomfield College, Wells Fargo, Johnson & Johnson, New Jersey Sharing Network, and by Choose New Jersey. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by New Jersey Monthly, the magazine of the Garden State, available at newsstands. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.